Through innovation, academic excellence, and family-centered clinical care, Children's Mercy Kansas City is transforming outcomes for children around the world. Welcome to the audio interview series, Transformational Pediatrics, with host Dr. Michael Smith.
Our topic today is intestinal rehabilitation, a multidisciplinary approach to care. My guest is Dr. Joel Lim. Dr. Lim is a pediatric gastroenterologist and director of nutrition support, and he specializes in intestinal rehabilitation. Dr. Lim, thanks for coming on the show.
Oh, thank you very much. Thank you for inviting me to give this interview today.
Sure. Thanks for coming on. Well, let's start off with this. Intestinal rehabilitation. What exactly is that? What does that mean?
Well, intestinal rehabilitation is basically we're trying to rehabilitate children who have lost the function of their small bowel. It means that they cannot actually absorb nutrients by mouth because of some underlying problems. When I say by mouth, it's through the intestinal tract too. And therefore, we try to rehabilitate these patients so that they can use their gut again to absorb food. So basically, these kids don't eat anything by mouth. They are completely fed through the veins.
And so what are some of the conditions that lead to that and require intestinal rehabilitation?
Most of these patients end up having resections during their infancy. Like the most common would be necrotizing enterocolitis, and other ones would be congenital, like gastroschisis, intestinal atresias, and sometimes motility disorders like Hirschsprung's disease, those that are pretty extensive.
And so the goal of intestinal rehabilitation, as you said, is to get the small bowel to do its job, basically, right, to function and absorb the nutrients. What kind of time frame are we talking about here? Obviously, this is critical, right? You're talking about a child who is growing in every sense of the word, right, or needing to grow in every sense of the word and really need that nutrition. So what type of outcomes have you had with this? What kind of time frame are we looking at to get the bowel working again? Okay,
well, most of the patients that we get are those who have had extensive resections of their bowel. Most of them have lost maybe 50 to 70%. We even have patients who only have 10 to 20 centimeters of small bowel left. So the time frame in rehabilitating these patients can take months to even years. We even have patients who have been on what we call total parenteral nutrition for the past 3 or 4 years, and but we have very good outcomes. We have patients who have had 20 centimeters of small bowel, even with 5 centimeters of colon B weaned off total parenteral nutrition, and they're completely fed through the mouth now, or through a G-tube, but enterally fed. So we have a very good success rate in trying to actually rehabilitate these patients, and we do it with a multidisciplinary team.
So why don't you run through exactly how you rehab the intestines here? What is the actual process to eventually get the bowel to function better? What actually happens during a patient's care?
Okay, so they start off having surgery or being born with a congenital problem that their gut doesn't function. So what we typically do is we feed them through the veins through total parenteral nutrition. Once they are stable enough, then we actually start feeding them very slowly, usually from 1 ml an hour to 2 ml an hour, until we get to a point that we are able to take them off total parenteral nutrition. And of course, we're waiting for their bowels to adapt, and stimulating their bowel slowly also helps in rehabilitating these patients. And of course, we also have medications that help us, and also sometimes, if need be, surgical procedures that will also lengthen their bowel. These are all in our armamentum to actually help in these patients. One other key thing, too, is the type of nutrient that we actually feed these patients. They're on specialized formulas initially so that they can absorb these nutrients more efficiently.
So who's actually involved in all this? We're calling this a multidisciplinary approach. Who's involved in the intestinal rehabilitation?
Oh, okay. Well, that's a very interesting question. We have a lot of persons involved, and before I start, I would like to let you know that studies have actually shown that to have a good success rate, most of these patients need to be plugged into an intestinal rehabilitation program. So most these programs usually consist of a pediatric gastroenterologist like me, a pediatric surgeon, a pharmacist that will take care of the TPN, a dietitian or nutritionist that will take care of the caloric needs. We have a nurse that specializes in central lines, G tubes, and feeding apparatuses that would be needed by these patients. We also have a nurse practitioner to help take care of these patients, and we have a social worker that helps with the social needs of these patients. And more importantly, we are one of the major centers that have their own psychologists, because we have realized that these are very sick patients that actually have a lot of stress in the patient itself and also in the family. And the way intestinal rehabilitation is going right now, most of these patients who have had death sentences like 3 or 4 years ago are now having chronic diseases. So they are now expected to live, and therefore they have a lot of stress factors. And we have seen that a psychologist really helps in having them cope up with this chronic disease, not only them, but also their family.
So backing up, before there was this type of multidisciplinary approach, in which you just said, right, the studies show that this does improve outcome quite significantly, right? What was the outcome prior to this for these patients?
Well, most of these patients would actually end up being transplanted, which is actually part of intestinal rehabilitation, but a lot of them don't survive. Most of them would have, they end up dying from line infections, dying from liver disease, which are also complications of these kinds of patients. So in the past, couple of years, we've actually been able to rehabilitate more and more patients and shorter bowels.
And the outcomes obviously improve. So we're seeing less deaths from the liver disease, the infections, et cetera, right? So is this approach, this multidisciplinary approach that you guys are doing at Children's Mercy, is this becoming the model for other medical centers throughout the country?
Yes, this is, there are a very few intestinal rehabilitation programs that are currently in the United States, and we are one of the intestinal rehabilitation programs that are, having a good success with our patients. And we do collaborate with all the other different centers too, because this is a very small field that, most of us are all working with each other to actually help these patients.
Well, Dr. Lim, I want to thank you for the work that you're doing in the Intestinal Rehabilitation Center at Children's Mercy, and I want to thank you for coming on the show today. You're listening to Transformational Pediatrics with Children's Mercy Kansas City. For more information, you can go to childrensmercy.org. That's childrensmercy.org. I'm Dr. Mike Smith. Thanks for listening.